Hi, my name is Marina Kovalenko, and I'm going to talk about my project, which is titled Opportunities for Addiction Management in Hospitalized Cases of Infective Endocarditis in People Who Inject Drugs, and I performed a systematic literature review. To give a little bit of background, infective endocarditis is a serious complication of injection drug use, which leads to the infection of the endocardium in the heart and can lead to very, very poor outcomes in this population. And so with the start of the 21st century, there's been an increase of incidence of infective endocarditis, and currently, infective endocarditis is almost 100 times higher in the population of people who inject drugs than within the general population. Not only is the incidence higher, but the mortality has been seen to increase and has tripled from 1999 to 2016. So studies that talk about addiction management have looked at addiction management in hospitalized cases of infective endocarditis in this population has shown that when addiction management is offered, it has reduced mortality rates, reduced readmission for infective endocarditis, and has overall improved the long-term outcomes in this population. However, when I was doing my research, I saw that there were a very low amount of studies that talked about addiction management, and when they did, the percentages were also very low of who was offered addiction management. So my systematic literature review aims to aggregate the current literature and determine how much or how often is addiction management offered to this population, what types were offered, and if there's any trends that I can see from the current literature. And the way I did that was looking through databases and looking for retrospective cohort studies that were published between 2016 and 2021 and mentioned diagnosis of infective endocarditis and injection drug usage, and also mentioned addiction management. So one of the most interesting findings that I had was that over all these studies, addiction management tended to be low in being offered to these patients. But what was even more interesting was any studies that mentioned both inpatient addiction management and outpatient addiction management I compared. So the way I did that was adding up the amount of times that addiction management was offered and dividing it by the sum of records for each one of these treatments. I did that for both inpatient and I did that for outpatient. And I divided inpatient by outpatient to create an odds. So in all admission, and when I say all admission, I refer to any studies that didn't specify whether or not this was initial admission or readmission. The odds tended to be ranging between 1.87 to 2.72, showing that inpatient addiction management had higher odds of being offered than outpatient addiction management. What was interesting was that studies that talked about specifically initial admission, when I performed the odds, I found that the odds of inpatient to outpatient treatment was even higher, ranging between 7.25 to 11.4. And so this is a very interesting finding because it shows that there's some kind of disparity leaning towards inpatient addiction management in initial cases, as opposed to inpatient addiction management for all cases. And so it'd be interesting to determine why there's a case, why is there a difference when you compare to all admissions and you look at initial admissions. And so this shows that there needs to be some more research into why there might be this disparity. And furthermore, why is addiction management so low? Because there's few studies, it would be very important to do some primary research and get some data on medical records to determine what factors may influence this kind of discrepancy. Another thing that the study has showed is that we do need some sort of intervention to increase the uptake of addiction management in hospitalized cases of infective endocarditis. And one of these ways may be to provide education and awareness to healthcare providers to show that there is some sort of missed opportunity and that it'd be very important, and this is a very good time to start these patients on addiction management, which can not only reduce the complications of infective endocarditis, but also help the substance abuse disorders. Thank you very much, and if you have any comments or questions, please do not hesitate to comment under this video.